Hi, welcome back to Dr. O'Donovan Medicine Made Easy. This video is designed for parents or carers of children who think their child might be constipated. I'll be covering symptoms of constipation, why children get constipated, what you can do to prevent constipation, and when to consider seeing your child's healthcare professional or seeking urgent medical attention. If you want to skip ahead to any of these sections, just find the timestamps here on the video screen. Remember, if you enjoyed the video or learned something new, please hit the subscribe button for new videos every Wednesday and Sunday. I'd also appreciate it if you could like this video to help other people find it. So first of all, constipation is common in childhood, particularly when children are being potty trained around 2 to 3 years old. The advice that I'm going to give in this video is aimed at children after weaning from bottle or breastfeeding, so that's those older than 6 months. So what are the symptoms of constipation in children? Well, these can be tricky to spot, and your child might be constipated if they don't poo at least 3 times a week, if their poo is often large, hard, and difficult to push out, if their poo looks like rabbit droppings or little pellets. If your child is potty trained, soiled pants can be another sign of constipation because runny poo, also known as diarrhea, may leak out around the hard constipated poo. This is called overflow soiling. If your child is constipated, they may find it painful to poo, and that can create a cycle. The more it hurts, the more they hold on to poo. The more constipated they get, the more it hurts, and so on. Even if pooing isn't painful, once your child is really constipated, they may try to avoid going to the toilet altogether. So why do children get constipated? Well, there's lots of potential reasons. These include that they're holding on to stool due to fear of using toilets, and that can be because toilets are smelly, they don't have privacy, etc. They're not drinking enough, they're not eating enough high fibre foods like fruit and vegetables, they're having problems with potty or toilet training, or they're worried or anxious about something such as moving house, starting nursery, or the arrival of a new baby. So how can you prevent your child getting constipated in the first place? Well, first of all, make sure your child has plenty to drink. You can offer breastfed babies who aren't eating solids yet plenty of breastfeeds. Formula-fed babies can have extra drinks of water in between their formula feeds. Next, think about giving your child a variety of foods, including plenty of fruit and vegetables. These are a great source of fibre. You can also encourage your child to be physically active. Movement can help stimulate the bowels and prevent constipation from happening. Think about getting your child into a routine of regularly sitting on the potty or toilet. After meals or before bed for 5 minutes is a good time, and you can praise them whether or not they poo. This is particularly important for potty trained boys who may forget about pooing once they're weeing standing up. You can think about giving rewards such as stickers or star charts depending on your child's age. Finally, make sure that your child can rest their feet flat on a floor or step when they're using the potty or the toilet. This is in order to get them into a good position for pooing, which you can see in this photo here. Remember, ask your child if they feel worried about using the potty or the toilet. Some children don't want to poo in certain situations, such as the nursery or in school. Remember, it's important to stay positive and reassuring. You want your child to see going to the toilet to do a poo as something that is normal and not something to be ashamed of. So what should you do if your child's constipation continues despite changing their diet and putting all these helpful things in place? Well, if your child remains constipated despite what I've talked about, then take them to see your healthcare provider. They can assess your child and help you think of treatment options depending on your child's age. The longer that your child is constipated, the longer it can take to get back to normal, so do get early help from your health provider. Laxatives often help children alongside diet and lifestyle changes. Movicol is something that's commonly used as a stool softener with stimulants such as senna that can be added in. It might take several months for these treatments to work, but keep trying until they do. And remember that laxative treatment may make your child's overflow soiling worse for a time. Finally, when should you seek more urgent attention? So if your child is experiencing significant pain or regularly soiling their pants despite being on treatment, you should take them back to see the GP or family doctor. Some children need more intensive treatment of their constipation. The health professional may decide that a paediatrician needs to be involved in their care. And remember, not all tummy pain is due to constipation. If your baby or child develops new, severe tummy ache, please make sure you take them to see a health professional urgently. Thank you for watching the video. I've included lots of useful extra links below, including a great website called ERIC, which is a children's bowel and bladder charity. They've got loads of extra useful resources which may be able to help you, and the link is in the description box below. Thanks for watching. Please remember to give the video a thumbs up, subscribe to the channel. Until next time, bye.